this meeting to order. It's the August 27th meeting of the Eastern Idaho Board of Health. We welcome any public who is in the meeting with us. We are glad for your attendance. If there are any questions that come up during the meeting, we invite you to go to the Eastern Idaho Public Health website, where you will find a portal, an email address for you to be able to email comments to the board. And we would be glad to try to answer those questions for you during the week, or if they can wait at our next meeting. So that is available for you. We would like to thank our staff who's in the meeting with us. Of course, we have our director, Jerry Rackow, as well as our epidemiologist, Mr. James Corbett, and other staff with us today. Some we will hear from later. Excuse me. This meeting is being conducted with Zoom webinar. There is also a room available at the Eastern Idaho Public Health Building for any public who wishes to come and attend the meeting at the location. And we appreciate all of the work and effort that goes into setting these meetings up. It takes a considerable effort, and we have strived in every way to be accommodating to the public and yet be able to conduct our business. And so again, we appreciate everyone at Eastern Idaho Public Health for their efforts. We'll start with our roll call this morning of our Board of Health members. Please identify yourself, and that way we'll make sure your audio is working okay. We'll start with our physician representative.
Dr. Barbara Nelson, present.
Thank you, Dr. Nelson. Jefferson County.
Commissioner Shane Young, present.
And Madison County.
Commissioner Mendenhall, present.
Fremont County.
Commissioner Miller, present.
Teton County.
Bill Lake, present.
Clark County.
Commissioner Shenton, present.
Lemhi County.
Commissioner Minor, present.
And Custer County.
Commissioner Butts, present.
Okay, and I'm Brian Reed, Commissioner of County. So thank you for all of you board members for being here today. I heard the governor, and many of you probably did yesterday on the conference call with the governor, point out that none of us realized that the positions that we held would be used in this way during this difficult time. But he thanked all of you, and of course I do as well. It has taken a considerable amount of time, and I appreciate the attendance of a full board here this morning. Our first item of business is approval of the August 20th Board of Health minutes. All the board members have received those, and they are also on our website. Is there any corrections or changes to those minutes? I would entertain a motion then to approve.
Mr. Chairman, I would make that motion that we approve the minutes of August 20th.
Thank you, Commissioner.
Second.
And there's a second by Dr. Nelson. All in favor, say aye.
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 All right, thank you. We will next move on to the review of our public comment. We did receive some comments this week and some questions. Many of the questions were able to be answered during the week by email. Just some I might bring to attention today. There was some questions and misunderstanding about the some of the happenings in the special session of the House and Senate this week, legislative session. The House passed a concurrent resolution on Tuesday asking to end the governor's emergency order, and some of our citizens were confused how that would affect Eastern Idaho Public Health and our actions. It really ended up being a moot point. the Assistant Deputy Attorney General, Brian Kane, in a letter to the Senate, declared that the actions of the House were unconstitutional. The Senate recognized that and did not take it up on that side. And so it ended there. It would not have affected us in any way, regardless. Our health district responsibility comes from Idaho Code 39-414, and it's separate from those actions of the governor that started last March. There was also a letter from a concerned citizen in Lemhi County concerning the Lemhi County Fair. I believe those concerns were handled, and we appreciate Commissioner Minor. Is there any other comments regarding that, Commissioner Minor?
Not at this time. I think we just had some poor judgment based on our fair board putting out some information they didn't really need to be putting out there. So I think it's been handled, and everybody's moving forward and excited and ready to do their part to be as safe as possible.
Very good. Thank you for doing that. And then there was a very detailed letter that we received from a group in District 91 that are called the D91 Teachers, Parents, and Patrons United. They had some specific questions regarding the upcoming school reopening, and we understand their concern. Director Rakow was responding to those questions. And of course, we're always available for information and to answer questions and needs as we wish the best for the school reopenings, and appreciate all the efforts they are taking to do it safely and to be able to get those children back to school as safe as possible. Any other remarks concerning the public comments that were received this week? Okay, we'll go ahead and move on then to our report from our hospitals regarding our ICU and our overall capacity. We do appreciate each week the time that the hospitals spend with us to keep us updated. According to our report, it appears that hospitalizations have gone down. So I was certainly glad to see that, but interested to hear directly from the hospital administrators and doctors. So looks like we will begin with Idaho Falls Community Hospital. Mr. Jackman, would that be you?
That's me. Good morning.
Good morning.
Thank you for having me. Yes, you are correct. We have seen a downtick in our hospital admissions. Moreover than that, we've seen a fairly good downtick in the number of COVID patients that are being hospitalized. We are still internally in the emergency room, we're testing 10 to 14 patients a day. The positive rate is still fairly low. At this point right now, I only have 3 COVID patients in the hospital. As we continue to monitor our resource usage, we're still in a good spot with a lot of capacity, and feel like things are trending in the right direction.
All right, very good. Thank you. Is there any questions for Mr. Jackman? Thank you again for being here with us.
You bet.
Mr. Hoffenberg from ERMAC, is that correct?
Yes, can you hear me?
Yes, we can. Thank you.
Great. Well, we are seeing a slight downtick in our COVID hospitalizations. Our hospital remains fairly busy. We're still very, very much busy with our burn and our trauma programs and all of our other admissions. But we are sitting almost where we were last week. We're at 18 COVID positive patients in-house. So we're at about 20, but we're still sitting between that 18 to 22 mark. It seems as we'll discharge a couple, get a couple more, but again, the acuity of these patients has significantly decreased over earlier on in the pandemic. So that is encouraging, but we are doing okay. Resources are stable. Staffing is much more improved with the lower census, but we continue to be able to admit to our ICUs and our med surg floors without issue at this point.
All right, thank you. Again, glad to hear that it is slowing down some. Are there any questions for Mr. Hoffenberg from the board? Well, thank you. We may have some questions when we're through here, so we appreciate you being on with us. We'll next go to Madison Memorial. Dr. Gonzalez, good morning.
Morning, everyone. Similar situation at Madison. We continue to average 1 to 3 inpatient COVID patients. Right now, she was discharged last night, the last patient we had. So currently we have none inpatient. We do have still a quite significant amount of outpatient testing occurring, but the percent of positives have not changed. So, and trauma is starting to slow down a little bit for us. That's about it.
Okay, thank you very much. Any questions specific to Madison Memorial? I had one question for all three of you, or for any of the other physicians on the line, actually. There's just so much misinformation out there, and it's just frustrating me sometimes to no end. On the House floor on Tuesday, Representative Barbieri stated that there was a person in a hospital somewhere, I don't know where, that was in for a shoulder surgery. And they clearly heard the doctor say, mark this as COVID related. And then Mr. Barbieri inferred that the hospital or doctors did that in order to receive additional federal funding or whatever type of funding there is, and went on to say how that is happening often. Now, I know the answer to this, but I guess I would be curious if anyone from the hospitals would help the public understand, is this happening? Would this happen in Eastern Idaho? What might be the reason that would have been stated? Would anybody take that up for me? Mr. Jackman?
Yeah, what I can tell you is there are a lot of rumors flying around. People like to be grandiose when they're talking about things going on in the world right now. The hospitals are under a lot of scrutiny and always have been. We risk a lot to do something stupid like that. To invite an audit where either the payers or the government gets involved is not something that we want to do. And I'm not going to say it's not a possibility that some place has done that, but I can tell you that the ethics of these 3 hospitals would prohibit that from ever happening.
Yeah, and I knew that to be the case, and I appreciate you confirming that. Any other comments on that? It is really troubling that those mistruths, that misinformation is out there, and then being repeated by people who are elected to be our state representatives and will use it in a political way on the House floor was concerning. Mr. Hoffenberg, any comment?
I would agree with that last statement you made, is that I think a lot of these stories, whether having any level of truth or not, which I would have a hard time knowing our hospitals, at least on this side of the state, to intentionally go out of their way to do something like that just for financial gain. I just don't see happening, because that's not the ethics that the administrators and the physicians I know throughout the region have. And so I think it plays to folks reaching for stories for things that have shock value, and I just feel as though we at ERMAC, and I know in this region, we don't have time for those types of stories to distract us from what our main focus is, which is taking care of patients. And so whenever we have that question come up, I mean, for us at a PPS hospital, those types of payments aren't even available to us. So it's not something that's even possible for our areas in the same way that it is in other areas or in smaller facilities. But for us, it's not our practice, it's not our ethics, and we just kind of hear it and move on, because our focus is our patients and taking care of them.
All right, thank you very much. And I appreciated your statement. We don't have time for that. And I feel like our board position, we don't have time for mistruths like that. We don't have time to get caught up in the political nature that some people have chosen. And we've not gone down that route. Instead, we've relied on our board physician for information. We've relied on all the education and training provided by our director and our hospitals and our community of medical professionals. And we have chosen that to be our guiding influence. And so I appreciate all the hospitals being on with us, and again, all the work that you're doing. We also appreciate our doctors in our area. We do have Dr. Buitrago on the line with us today, and appreciate her weekly attendance with us. And again, as well as our board physician. Dr. Nelson, is there anything you want to add before we move on in our agenda? Okay, we will go ahead and move on then.
Mr. Chairman.
Yes, Commissioner, go ahead.
Before we leave this, for the hospitals, one of the thoughts behind the orders that we have put out, and when we were developing the plan and all of that, was that we did not want to overrun our regional hospitals, and we identified the 3 that reported today, that we didn't want to overrun them from all surrounding counties feeding into those 3 hospitals. Do you, and I'm really appreciate the positive report of a decrease. That'll come up later of what do we do now. But are you seeing those cases that you do have, whether it's Madison Memorial seeing an uptick in testing, or ERMAC seeing an increase of admissions, or whether it's Idaho Falls Community Hospital, whatever they're doing? Are you seeing transport from surrounding counties coming into yours, or is it, for example, the high population of Bonneville, is the higher percentage from Bonneville residents? If I'm not making myself clear, I'm trying to make sure that we're meeting our mission and our goal of keeping the pressures off of these hospitals from surrounding counties flooding the hospitals. We've seen an uptick, and Commissioner Young, I'm sorry, but Jefferson County has been a hotspot. Are these people that are being admitted from Jefferson County, from Teton County? Do you have any kind of feel of where the admissions are coming from? Not county specific, but are they coming from out of county?
They're coming from all of our counties that we serve.
Okay.
And including the testing that you see, which I just bring up the testing just from a resource standpoint, that again, it isn't just the sick of the sick for the inpatient COVID that puts a demand on our hospitals. It's the other things that we do as well. And so I just am using that as an example, but again, it's all manageable at the moment. But yeah, for us, we're seeing them from all of our counties that we serve.
Mm-hmm. Yeah, at ERMAC, it's the same. I mean, the makeup of our COVID patients is the same as where we typically see patients coming from. We just serve such a large region, and whether it's central Idaho, southwestern Montana. I know we've gotten patients from outside of the county, but the majority right now are from within Bonneville, but there's still, I'd say about 40% that are from outside.
And I would agree with that too. We've only had 2 COVID patients from outside the Eastern Idaho Public Health District. One was traveling to work at the INL and another one was traveling on vacation.
All right. Thank you very much. We'll go ahead and move on to the next part of our agenda, the COVID-19 update and review. We're going to continue to work through this agenda. I might mention, we do need to be done as close to 8 a.m. as we're able to today. So, Jerry, we're interested to hear your report.
Thank you, Mr. Chairman. I'm just going to pull up our data dashboard and we'll review the data related to the metrics for our region. We have continued to modify our dashboard, again, trying to make it as user-friendly for the people that are accessing this information as possible. And that is the media, it is, county officials, and the public. And so this front page looks a little bit different. We were requested, and after last week when we talked about the new antigen testing that is going to result in more probable cases being identified, we added that back on our overview. We also incorporated right here on the overview page the current average test turnaround time. And so over the past 7 days, the average turnaround time for test results is 2.8 days. We will continue to update that. It does give us a good indication as what is happening. I know we have seen an overall decrease in cases, a decrease in individuals seeking testing over the last couple of weeks. So we're monitoring that very closely.
Mr. Chairman.
Go ahead, Commissioner Shenton.
Sorry to interrupt, but I was visiting with Commissioner Miller and he was having trouble. I think he's back on, but he's muted. Can we try to get him fixed up?
Yes, I'll work on that. James, do you want to talk about the metrics?
Yeah. So certainly, as Jerry said, our overall cases for the district have decreased in the last few weeks, as well as the percent positivity. We just actually received this morning. We don't get these on a regular, ongoing basis from the state, but we do get occasional, and we'll post this this evening as well. The percent positivity of testing peaked, and you kind of heard that from the hospitals 2 weeks ago, or with their reports. The percent positivity kind of peaked 2 weeks ago with 18, just over 18% positive, now down to about 14, what we're seeing. Again, we'll post that later today, this evening on our website with the normal update. I would just reiterate what the providers are seeing, or what the hospitals are seeing, that we do see hospitalizations from across our area, and that's true with our cases as well. There's very few areas that are unaffected, but it is spread out, and there is a slight decrease. So right now, if we can roll down just a little bit, that's okay. We'll just go through each individual county here, and maybe scroll through the Bonneville County cases. These are the blue bars again are active, are the report dates of each cases. So how many cases in that day, regardless of whether they were active. And again, active being those that are within the last 10 days or still under EIPH monitoring or still considered infectious. So regardless of whether they were reported as active at that time, they were included in that blue bar chart. And then the active case trend line, really, or that active rate, is highlighted in that line that goes across. So PAP state study for the last 2 weeks, after kind of reaching a high back on August 10th, potentially of getting close to, well, it was just over 20, 22.5, as Jerry's highlighting there. So we are have seen a slight decrease over that time. We are usually hovering right in the 15 area, plus or minus a point or two. Active cases per 10,000 in Bonneville County. Going down further, the next one being Clark County. You can see, again, a high degree of variability with their smaller population, with a peak really on August 13th of number of cases that we saw with being active. Since that time, most of those individuals have been released and are considered no longer contagious or infectious. And really, we just had another 2 individuals actually have just this week or yesterday. So it does increase. Okay. I can try to speak louder.
It's just a little bit garbled.
Yeah.
Jay. It's not real clear.
No, that's okay. I'm going to move places actually, and hopefully this is a little more clear and I can run the screen here. So Clark County having the active, is that better, Commissioner Reed?
That's perfect. Thank you.
Thank you. So Clark County, again, the high degree of variability in their cases and their rate due to just the smaller denominator, that smaller population for Clark County. Moving on to Custer County, again, a few cases that are coming in. Again, their active rate never getting above 13 there, almost 14. Right now, we did have a few more cases reported yesterday, and we'll continue to monitor that. Fremont with a peak of 17 on August 9th, again, culminating kind of a above average previous 2-week period. Did put them in. Since that time, they have, again, we'll talk about this in more detail if you'd like, but since that time, they have met the threshold of 7 continuous days under the threshold. In fact, do you remember the exact number? How many days? 10 is Fremont County. I'll look again. I'll count that up. Yeah. Moving on to Jefferson. As Commissioner Mendenhall reported earlier, they do have a continuing kind of increase of cases. Their active rate has continued to climb and with a slight decrease over this last, but really staying fairly steady at around 16, give or take a few individuals on their active rate, again, per 10,000. Lemhi did see a peak, again, kind of August 17th. They've since declined. Again, counties with smaller populations will have a higher degree of variability with rates, even though that rates do account for some of taking that peaks and valleys out, but they will have a higher rate just due to their smaller or higher degree of variability in their population. The same with Madison County. They've been steady, having cases fairly equally throughout, but their active rate really staying about 5 to 7 throughout. Again, we've talked about this before. There's certainly things that are perplexing, and continuing on that, another county that's still slightly perplexing to us is Teton County. The cases are due to the degree of variability with the smaller cases a little bit, their active rate, but they continue to see kind of waxes and wanes or increases and decreases to their cases depending on just the number of individuals that are infected. Again, this number on the right is the active case, not the number on the left over here is the number of cases seen in a day, just to clarify that. So this is the overall district. You can see maybe slightly a curve here. We're seeing a downward trend, especially in the last 2 weeks or the week and a half. For the most part, with our major population coming in Bonneville County, it follows Bonneville County to some extent. But overall, the district number of cases have seen a slight decrease per day over the last few weeks. We are still seeing a slight decrease, but again, the active rate for the overall county about 15, and really down to just under 13 as we sit here today. This last chart, again, just showing the kind of counties all together. We were asked to put this back on. It is kind of slightly confusing, and I apologize, but if you hover over the lines, it can tell you what the counties, and you can compare them. The response plan for the healthcares, as you heard, this first one is ICU occupancy. I'll just remind that you can hover over and see maybe since the middle of July, we've seen a slight decrease in our ICU occupancy. I think this is mostly attributable. This is not just tracking COVID patients. Again, our overall concern is that we retain hospital capacity for all patients. So this tracking is tracking all ICU occupancy. A slight decrease, as noted earlier from the hospital reports. This is most likely due to decrease in trauma being seen, but they are still having those. So just to reiterate what they've kind of reported, there has been a slight trend line down for ICU occupancy, again, for all patients. Percent capacity used for overall occupancy is slightly just kind of really been on par, maybe a slight increase over the last few weeks, as I've highlighted here, but really staying fairly steady across the entire time frame. I indicated this earlier, but the percent positivity did peak kind of in here around the 20% range, and we're seeing a slight decrease. This has continued, but again, we'll update this with information that we just received for this past week later today. Yeah, the most recent one, again, being 13, that just actually 13.9, so almost 14%. So continuing to slide down from this last date that we have. So we're pleased with that, having a decrease in that. We're pleased with the cases in Bonneville County declining. There are still cases that are ongoing, kind of spread throughout the district. We are seeing that. We have, but we're pleased with the direction that some of the trend lines are occurring. We encourage people to continue those compliance measures that will help that to continue to decrease. That is the end of the report for the update on our metrics, Mr. Chairman.
Thank you, James. Would it be fair to say that that does line up with what you would expect from the mitigation strategies that we did put in place, particularly in Bonneville County with our large population? I mean, and it appears to me that that's when it has begun helping.
Yeah. So I'm going to move back to that Bonneville County. Certainly there, again, a higher degree of variability with sometimes the smaller population counties, but from an overall district and specifically Bonneville County, we implemented the order July 21st right here as our cases continue to increase. We do expect that that is a normal trend. The strategies, as we've talked before, will take time to have an effect. Up to what we suppose is really 2 incubation periods or 28 days for this disease. It did seem to align with that. Now, I can't take a specific correlation from that. There's other circumstances, certainly, but yes, we're pleased with potentially the compliance with those strong recommendations and order that was put in place by the board, and we've seen a decrease in the cases as such.
All right, thank you. And that was, as everybody knows, that was the purpose for what we've been doing. The entire purpose is to support the hospitals and the medical community around here to make sure to maintain capacity and to get these cases in a place where it's safe for schools to start and for all of us to continue living our lives as much as possible. And we appreciate all of the support and participation that we've had from the community has helped us do that and continue to encourage it. Are there any questions from board members?
Mr. Chair, this is Commissioner Minor. I do have a question backtracking to what Jerry said earlier as far as putting the probables back up there due to the antigen testing. My question would be to her or James or even in the hospitals, as far as reporting COVID goes, if someone tests negative for COVID, but then goes in later and tests for the antigen and tests positive, does that in turn turn back and become a positive COVID test as reported?
Commissioner Minor, this is Jerry, and I just want to clarify, we're talking about two different things. What you're speaking about is antibody testing, and we're talking about antigen testing that is a diagnostic test. And so the answer to that is we do not count any antibody tests in any of our case reports. It only is diagnostic tests, the PCR test, the confirmatory test, and then the antigen test is a PCR test, but it is categorized as a probable rather than a confirmed. Does that answer your question?
Yes.
Thank you. Are there other questions from board members? All right, if not, thank you for that, and we'll go ahead and move on to item 6 on our agenda. We are glad to hear that there are counties that have come back down under the metric for us considered today. Jerry, would you review that for us and what actions that we may be able to take today?
Yes, give me just one moment to pull up on the screen. I can't get rid of this. We do have 3 counties that are up for consideration today. So I'm sorry, give me just a minute.
Mr. Chairman, while she's pulling that up,
Commissioner Mendenhall.
I've been thinking about this for a while, and I'm not proposing anything now, but I'd like to put it into the minds of board members and to Jerry and to James. We hear the phrase the new normal and all of that kind of thing. I've really been wondering, when do we take a look and decide that COVID is here, it's going to stay here, and when we finally have what they call flattening the curve or whatever it might be, do we have an exit strategy at all of when we stop monitoring counties, when we stop having this mandated order hanging over their heads? And I'm not proposing anything today, but I think it needs, the tip of the iceberg needs to at least be in the minds of someone. Do we as Eastern Idaho Public Health, do we have an exit strategy of when we have reached manageable COVID? So just throwing that out while Jerry's bringing that up, and no action needed, but I wanted to bring that up because that's going to come up in the next month or 2 or 5, whatever it might be. And I think we need to start looking at a metrics about that as well. So thank you, Mr. Chairman.
Thank you, Commissioner Mendenhall. Go ahead, Jerry.
We did talk about this early on as we were developing our plan, and a couple of things play into that. I think we are going to have these mitigation measures in effect for some months to come, and part of that exit strategy is when a vaccine becomes available for people to be immunized against COVID-19. We anticipate that to be early to mid 2021. And they are working on vaccines now. Some indication that there would be limited supply for priority groups sooner than that. But part of the vaccine, part of the exit strategy is the vaccine availability. And some of these other protective measures, we are going to have to continue if we see the increases in cases continue over time. We anticipate that we'll see waves, and from what it's looking like now, I mean, have we hit the peak of this current wave and on our way back down? But it's very likely we could see another wave, and specifically as we potentially hit into flu season later this fall and winter. So for the next several months, these precautions will need to be in place. And then hopefully by next year at this time, things are returning to what we consider normal.
Okay. Thank you, Jerry. And thanks for those comments. I mean, that's certainly our desire for all of us, is to be back to normal. And I hope it's not a year from now. I hope it's much sooner, but I continue to have hope. So Jerry, what actions are we considering today?
All right, for the board's consideration, we have orders lifting restrictions for 3 counties today, potentially. Now, the first is Fremont County, and this order has been in place for 17 days. For the last 10 days, they have been under the metric of the 10 per 10,000 rate. And so it is my recommendation that the order of restriction for Fremont County be lifted today, effective immediately. So this is the first time we've seen that the board has seen this document. Our legal counsel helped develop it. It just talks about that according to our plan, the county has fallen below the threshold and requiring the order of restriction, which was the limiting on social gatherings and events and requiring the face coverings in public. And because of them falling below the threshold, that those restrictions are no longer applicable for the county. It goes on to say that the order of restriction that was issued on August 10th is rescinded. It does say in here that even though the order is no longer in place, it is still the recommendation of public health to continue taking those preventative measures of staying home when you're sick, washing your hands, maintaining the physical distance, and wearing cloth face coverings when in public and not able to physical distance from others. So that's the first order for consideration.
Okay. Let's go ahead and review all 3 of them. We may be able to do it just in one motion.
Okay. The second one is for Lemhi County. In Lemhi County, the order has been in place for 14 days today. However, they have not hit their 7-day mark of being under the 15 per 15,000 rate yet. So my proposal here is if for the next 3 days, they continue to be under that rate of 15 per 10,000, that the board consider lifting the order of restriction. And I'm proposing that it's effective on August 31st. It would be Sunday that 3 days would be met. But the proposal is for August 31st, which is the next business day, because it does require us sending the order out to the county and the cities for notification of the public. The same is true for Clark County. Now, Clark County, the order has only been in place for 11 days. But as we mentioned earlier, they did drop to 0 active cases for several days, but have bumped back up to 2 active cases, putting that at a rate of just a little over 23 per 10,000. As James and I were talking, and the board knows that Clark County has been handled on a case-by-case basis because of its very, very small population. James and I would feel comfortable, but as long as Clark County stays below a rate of 50 per 10,000, that we would feel comfortable lifting this order. And so for the same reason that they've not yet met the 14-day mark, which would happen on Sunday, that we make this lifting of the order effective on Monday, August 31st. Again, assuming that they stay below that rate.
Okay.
Those are the three actions for consideration.
And it's not unprecedented for us to put an action in the future, such as these two. We did that with Teton County back early. So when, because it is such a long time before our next meeting, a full week. So questions from board members or discussion?
I just comment.
Go ahead, Dr. Nelson.
The schools are opening up and we're going to see a rise in cases. That's been the experience in communities throughout the world when schools open up. So I think the messaging, the yo-yoing of a mandate in place, mandate lifted. I know you like to stick to the plan, but I would prefer a stronger masking message as schools open.
Okay, thank you. And that certainly is the preferred. And I believe most of the schools are asking that, but that is something that's very important for those schools. We recognize that. Other comments? If not, if there aren't any comments or questions, I would entertain a motion and then we can have more discussion.
Mr. Chairman, I make a motion to move the counties back into the green that Jerry presented, Fremont immediately, and Clark and Lemhi being on the dated facility.
Commissioner Butts would second that.
Okay, there's a motion and a second to go ahead and rescind the order for Fremont County as of today, and Clark County and Lemhi County would be in effect on August 31st. Discussion on that motion. I know Dr. Nelson has already weighed in the importance of these schools continuing these masks and how helpful they have been and will continue to be as they open these schools. Is there other discussion on that?
Mr. Chair, Bill Lake.
Go ahead, Bill.
I share Dr. Nelson's concerns with the schools opening. However, I think that by lifting these orders, hopefully with the actions that the school boards in consultation with the public health district has worked out, that we can keep those rates, active rates down below these levels. But I would like to tell the public that we're going to be monitoring this on a daily basis through the schools. So the first time we get an indication that things are not heading in the right direction, I'm confident that our board will come together and address those immediately. Thank you.
Okay, thank you. Is there other comments or discussion?
Mr. Chair, this is Commissioner Minor again. I also believe, I understand Dr. Nelson's point on that, and I think it's very valid. But at the same time, somewhere we have to put a little bit of responsibility on our citizens to do the right thing, and where we've mandated things and it's shown that it's work, and if they do their job, then we get to go back and do, kind of thing. I think education throughout this whole thing is going to be kind of ongoing, and we're gonna lift some things, and then if it goes bad again, it's just proving some points as far as what we're trying to do. So I think we sticking to our plan is the best policy.
Okay, thank you. Is there other discussion? Hearing none. All in favor of the motion as presented, say aye.
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 And all opposed?
I'm opposed, and I just want it on the record that I felt all along we need stronger mask mandates, but I see your point of sticking to the plan, but I still vote opposed.
Okay, thank you, Dr. Nelson, and we value that, and we know it to be true. Has anyone abstained from this vote? Okay, the motion passes then. And I appreciate all of your work and efforts here today. And again, I want to reiterate that we appreciate Dr. Nelson and agree. We, as a Board of Health, we're trying to hit such a fine line of most importantly, doing the responsibility that we're called on to do in order to prevent and disease in our area, and at this time, particularly to manage this pandemic, this virus that has come upon us in the very best way we can, and at the same time, recognizing and appreciating the freedoms and the choice that our citizens have. We cannot strongly recommend enough that they follow the guidelines that have put us in the position to lower these cases that have been exercised in the mandates, and that we continue those. Our work has always been and continues to be to keep the numbers low enough that we can continue to live our lives. And at this time, most importantly, that these students can go back to school and the schools can exercise that safely, that the teachers will be able to be safe and all the work there. It's just so important. And so, Dr. Nelson, we do not disagree with you, and we hope that that these measures will be followed on their own. We'll go ahead and move to an update of our educational campaign. Jerry, do we have Mimi Taylor with us?
Yes, Mr. Chairman, Mimi is here. I'm going to turn the camera to her and let her give an update, and then we have some things to show you.
So Mimi, first I want to say how much we appreciate you as our public information officer. You have just been outstanding. You've answered so many questions and helped the public in so many ways. So thank you for what you're doing.
You're welcome. It's been such a pleasure to work on this campaign and to work with so many of the professionals in our community to help us design these materials and to just continue to reiterate what we've talked about all along about mitigating strategies. Okay, so we had talked when we originally launched just a month ago that this would be a multi-pronged campaign, and we have done that. We started originally just from the get-go rolling out.
There is some, yeah, okay, go ahead.
Okay.
Getting out immediately some social media outreach with a boosted Facebook post, and got a lot of community engagement, answered a lot of great questions. We've also done some videos that we're going to take a second. They're just 2 30-second videos that Jerry's going to share. We're going to have the ability to have those placed as public service announcements, and then to get them played across our website, social media platforms of all of our partners. So.
I contracted
Hold on just a
COVID-19 in
minute.
early April. My wife saw me.
Need to do a new share apparently. Can you see that?
In COVID-19 in early April.
Yeah.
My wife saw me turning blue due to the lack of oxygen, and we headed right to the ER. There were nights that scared me much more than when I had cancer. I felt like I was sitting at the bottom of a pool, but I couldn't breathe. COVID-19 is real and affects real people. Let's keep our economy open, but let's be smart. It's up to us to protect each other. It's up to us to protect each other. Please wear your masks, wash your hands, and make sure to practice social distancing. It's not too much to ask.
Just a minute, we'll pull up the other one quickly.
On the 4th of of July, I attended a family picnic, not knowing I attended a family picnic.
Sorry, just a second. It's hard to switch between these two. I apologize.
You're doing fine.
On the 4th of July, I attended a family picnic, not knowing I had COVID-19. I ended up passing it on to 10 of my family members, including my elderly mother and father-in-law, which was devastating for me. I'm here to tell you COVID-19 is real. Let's keep our schools and businesses open. It's up to us to protect each other. Please wear your mask, wash your hands, and make sure to practice social distancing. It's not too much to ask.
So those are just two simple messages from two individuals that were our actual cases in our health district, kind of sharing their messages as to maybe the impact and kind of doing that plea to the community that we're in this together and to do those simple strategies. And again, we're looking to get those placed as public service announcements on various platforms and for our partners to share those. We also had this right here is.
They can't see it yet. Why can't I see all the windows? Can you talk? Just talk. I can't see yet.
Okay, so Jerry's working on pulling some stuff up. We did, in addition to the videos and the social media, we had some graphics designed that can be placed on tangible items that can be placed within the community, including banners, pop-up banners, banners like for fences or for outdoor locations, posters, both larger posters and 8.5 by 11 size posters in both, and most of our materials are bilingual, both English and Spanish. So are they able to hear? So this is the poster. It just goes through the mitigations. You can see the graphics tie back into the graphics we used for our guidance sheets that correspond with our plan. So it's really kind of an all comprehensive for it to visually look from our strategic plan to our guidance sheet to our educational outreach materials. So this is our poster. They can be purchased. This is our banner that can be purchased. We set it up with our design company that people can, if you're interested in purchasing, can just go there. You can individualize it with your own logo. And yeah, and so that is just really wanting to encourage people to, when we don't have an order in place, that these are the strategies that we can do every day just to help with slowing the spread. And that was our campaign, slowing the spread of COVID-19. So thanks for the opportunity to let me work on this. And please, in your counties, share this with your community members across social media, website, any way we can get this consolidated message out that we're all in this together to help slow the spread and get us back to normal. Thanks.
Thank you very much, Mimi. We appreciate all the work that you've put into this. And I know in Bonneville County, we're printing those posters right now and we'll have them hanging in our buildings. So thank you. And thank you to the community members that were willing to participate in those two videos. Mr. Lake?
Mr. Chair, the question I have is Mimi getting these out to the county PIOs, or do we need to take that action ourselves to get this stuff distributed?
Yes, I have. We've sent out to the emergency managers, the PIOs, a pretty broad range distribution list has received this. But as county commissioners, since sometimes you might have a little sway because of your positions, any way that you can reach out and encourage your emergency managers, your PIOs, to get these materials used across social media, to purchase them, to get them up, in your counties, in your schools, in your businesses. It's just something, unfortunately, that that people just need to be reminded of to kind of stay on track. And these strategies, one great thing about them, a majority of them aren't just going to help with this pandemic, but they are really lifelong public health strategies. that are going to help throughout this flu season, get us through COVID, and in the years to come for battling communicable diseases. So please encourage your communities to participate in this, and thank you for your efforts.
Yeah, can I make a comment, Mr. Chairman?
Go ahead, Commissioner Young.
Yeah, I really appreciate the local residents participating on this. That carries a lot. I'm reading through all these comments, and there are some very good comments we're getting from the public that are giving us scientific papers and things like that concerning masks. And I guess what's come out of that for me is one of my biggest concerns is perhaps the lack of understanding that masks are contributing to fighting this spread. You know, we're getting these papers that really are not applicable to our situation, showing how ineffective masks are. And we know that by wearing a mask, what it does is de-accelerate the vapors, the droplets coming from a person wearing the mask. And from what I'm seeing, that message is not getting out there. And how a mask works in fighting COVID. And because, like I say, I'm getting a ton of these research papers, and I think some of the public's missing the point of how a mask really works. Like I say, I wear the mask in places of business, things like that, but because I'm on the board and we're getting wonderful guidance from our local experts, this information is not getting to the public as effective as I'd like to see it. Because I'm wearing a mask, and I realize that mask is not really protecting me that much if I'm around a lot of people that do not have a mask on. And somewhere in the minutia, it's all getting lost, I think. So I'm wondering if maybe it would be well if we could educate the public on how a mask increases social distancing and helps in fighting COVID.
Mr. Chairman and Commissioner Young, those are continual messages that we push out on Facebook nearly every single day. But Mimi and I will talk and see what we can do more specifically surrounding the mask strategy.
Okay, thank you. Thank you, Commissioner Young. Any other comments before we close? I think we're at the conclusion. Seeing none, we'll go ahead and bring this meeting to a close. I know there are, Jerry, you had some other items for us to, there isn't any.
For the board meeting today.
Okay. All right. So that go ahead and concludes the board meeting. We appreciate all of you being here, and we'll call this to a close. We'll plan on meeting next Thursday at 7 a.m. unless otherwise directed. Thanks again. Have a good day, everyone.
Thank you all.
Thank you.